ARCS is a really remarkable organization. The services that we provide are important because there really isn't anybody else to do it if we're not doing it. There are people who are living with AIDS and their families that rely on us to meet their needs. We provide nutrition services and pantry. We provide transportation. We help people get to their appointments. And we provide some mental health services and substance abuse services. So we really cover the gamut of the needs of our clients.
I needed help and stability in my life. I didn't have a home and I was living in transitional housing, and I really needed the support. My case manager talked to me a lot about me and what I could accomplish in my life. Being an African-American woman living with HIV, having no work experience, and just to come here and work in the food pantry gave me work experience.
I mean, where would they go? How would they go from place to place? What would they do? Life would be quite diminished for individuals living with HIV and AIDS if ARCS were not in existence. The managers are writing grants and communicating with funders. The case managers are dealing with client issues. One client may come in and have an issue around being evicted from their housing. Another may have a domestic violence situation going on. Someone else may be needing nutritional support, run out of their food money. Another person may have no money for medication.
If you need housing, you got problems with your food stamps, or you need to get Section 8. If you're doing drugs, you need a detox, they will help you. I think with anything, they get involved with your life, and it's unite number, you're a person here, and that's very important to me.
People are still, to this day, afraid of talking about their HIV status. And their neighbors don't know, many family members don't know, and with a number of the clients I've worked with, they're usually very frightened about their status and about whatever is going on with them medically. So the work here at ARCS really and truly is client-centered. We really work with people where they're at and meet their need. Not the need that we think they should have, but the need that they really, in fact, have.
As a case manager, I get to meet the client, face to face, talk to them about some of their issues, and figure out how it is that we as an agency could help them. They've been stigmatized and pushed to the side for so long, made to feel like they were less than. They come to a place like this to find out they're just like anybody else. They've had some misfortunes, and you know what, it happens. But we let them know that they're real people and shouldn't feel like they're any less than anyone else.
You're running away a lot of the time from the stigma related to the disease. You hear so much in the very beginning of it. It was such a derogatory thing, and you felt ashamed that you have this disease. And then I met these people at ARCS, and no one made me feel the shame, and that was very important to me at that point, because I didn't know exactly what I needed or required, and they started right at the beginning training me.
It's very difficult for them to do that sometimes, so Jill's program actually teaches them how to feel confident.
One of the things that we offer clients is consistency in the services that we provide and the comprehensiveness of the services we provide. We take all aspects of the individual into account when treating them and providing them with services.
It wasn't until the realization when I started my medication. That's when I totally broke down. I cried and I realized this is what was going to happen for the rest of my life. ARCS has shown me the right direction as far as what they had to offer, and I really think that it's a blessing to anybody who has AIDS that there are directions that you can go to get help.
ARCS is a place where people can feel safe to come to us and that we won't judge them. It doesn't matter what they tell us. We won't judge them. We're here to help them. They know that here we care about them, and we will do what we can and need to do, many times above and beyond, to really help them. And they know that, and they spread the word, and that's how we get the referrals. People really are happy with what we do because we take it personal, and we work really hard to really help people.